Hey, hope you're doing well out there. It's Dr. Matt here, and today I actually wanted to teach you some things that you can do for yourself when it comes to the knee. Now, a lot of the times, this is in particular if your knee's stiff, achy, or if you find yourself at the end of training, you notice one side's a little more stiff and sore and it's always acting up. And a lot of times, limited mobility, not using your muscles correctly, or not enough strength in certain joints, where you start to compensate and pick up bad habits and start to notice your knee maybe being more sore and not moving as well as you'd like. And I also think about the hip, because oftentimes if your hip doesn't move very well, I'll show you, if your hip doesn't move in all ranges of motion and gets stiff and stuck, a lot of times it beats up on the knee. So I'm going to talk today about the hip as well, because I feel it's so important to help your knee. So I consider, what kind of habits do we have during the day, and how can you really start to undo some of those with some of your 5-minute routine, strength training in the gym, whatever it is that you like to do, sports, volleyball, basketball. How can you actually create some habits to help yourself to make things easier? So in particular, I'm going to show you some mobility exercises and some stretches that you can do to help if you find yourself getting some knee discomfort, some knee pain. Now, as your family corrective chiropractor, I think about the whole system, the whole chain. Now I'm going to show you some things you can do at home, but I want to talk about the anatomy a bit too, so you can understand your body more. If you understand your body more, typically you'll get a better result if you understand what you're doing, and typically it's a longer lasting result if you have some education to go with it. So you'll see here, if you spend a lot of your time like this, sitting, and let's say your hip moves from here to here every day, and then all of a sudden you try to jump, squat, move around, maybe play basketball or volleyball, and you have to extend a little more and maybe squat down, and instead of stopping here, now you have to go to here. So your end ranges may be limited. If your end ranges aren't moving well in your hip, it's probably going to beat up down below in your knee in terms of how you squat, how you move. So consider your hip, your knee, but also the health of your spine and your nervous system, which I'll talk about in a little bit. But if your nerves are irritated, or your spine's stuck and shifted and the nerves are irritated, it may be impacting your health in ways you feel, but also in ways you may have no idea about. So a lot of times I'll check people, maybe they have some knee discomfort, their pelvic alignment is off as well as their lumbar spine, and they may be distorted up top as well, which in order for you to function and heal at your best, this whole communication system has to work at its best so you can be at your best. So consider this too. Now, what can you do for your knee? If you're hanging out at home watching this video, I want to show you some ideas. Just like this. Both sides, even if my left knee is aggravated, I'll still work my left side and I'll work my right side. But you'll see here what I'm doing is trying to bring my heel to my buttocks. Great stretch, hanging out, breathing. Probably one of those ones that we should add into our toolbox every single day, in the sense that if I get home and I spend a few minutes checking my emails on my phone, hanging out at night, I really want to just get in this position on the couch and let's say 90 seconds to 2 minutes trying to bring my heel to my buttocks. If you find this is too much, come down. Just like this, start here, toes pointed back, and you can bring your foot at the appropriate angle on the back of the couch. I would start with that one, keep it simple, 90 seconds to 2 minutes. Now, while you're here, what you're actually going to do is the opposite. So a lot of times, if these areas are tight and stiff in the hamstring, I'm going to teach you something called a contract and relax cycle. So you're actually going to bring your heel up to an elevated surface. And now, mind you, I bring my heel up here, right? And what I'm going to do is, just like this, bend at the hips. As long as you can keep your legs straight, you're in a good position, and lean over at my hips until I feel that tension in the back of the hamstring. Now, a little trick to this one, you're actually going to push down for 5 seconds. So actively contract your hamstrings and then relax and lean forward to 20 to 30 seconds. Now do the same thing, push my heel down actively, so I'm contracting my hamstrings, 5 seconds, and then relax 20 to 30 seconds. Trying to progressively lean forward each time. Feel that stretch in the back of the hamstrings, and noting a difference in terms of how you move. Now, when you bring yourself up, you want to see, if I've worked on my right side, okay, a little bit easier on my right side, and then I'm actually going to see what the difference is on my left side too. So let's say your left side is aggravated, you've been working on your left side, I'd still suggest work on both sides to help optimize how you move. Consider those 2 stretches. The couch stretch, really good. Something simple you can do. You sit on the couch at night for a few minutes to watch 20 minutes of your favorite show. Spend 3 or 4 minutes doing that, okay? And then the hamstrings, contract, relax, probably something you're not used to. Give that a try as well. Now, in terms of if your knee is sensitive, you're getting knee pain, some things that I find to help desensitize the area, help move you around a little more, and I've worked on at home just with my own strength training routine and own fitness routine that I have found useful. Grab the ball just like this. I think this ball is something simple that you can keep at home to use, or keep one at your desk. And what I'm gonna actually do is right where I feel those tendons, hamstrings coming into the back of your knee, what you're actually gonna do is right where that muscle becomes the tendon, I want you to push, give a little bit of pressure down like this, and now I'm gonna flex and extend. And I can start not worried about my foot at all, but what I'm doing is bringing my foot up like this, and then dropping it down. And here, I'll change sides so you can see a bit better. But what I'm doing is flexing, extending, and you may find you're a bit tender in the back of that knee, right, on the upper thigh portion. And I'm putting the ball here above the crease of my knee. I'm doing the inside as well as the outside over here. And what I do, flex, extend, I may do 5 to 10 passes. And now add an element to it, bring your toes up to your nose. Come up, toes up to my nose, toes up, toes up. And again, 5 to 10 passes, working on both sides. The last thing I want to leave you with is working on the quad. So you may get really, if your muscles are trying to protect you, and some of maybe the passive structures aren't working as well, you got to rely on the more active structures like your muscles, your tendons. So I want you to, they may be stiff and sore. So the teardrop on the inside of your knee, as well as the outside, where you fall off your kneecap, little divot, and then you feel your muscle mass, your lateral quad. What you're gonna do is you can actually lay on the ground or a bench like this, and I'll show you what it looks like. But what you can do is flex, extend your knee again, but you're gonna put the ball between you and the surface. Start softer, maybe on the carpet or on the ground, before you actually were to get onto something harder like this. And I may be on the outside of my quad, and when I'm here, I go flex, extend. Now with this, you can use a foam roller as well. You may find the surface area a little more comfortable. But I'll go through a range of motion, and then I'll go to the inside, the teardrop, and again, working on the quad, the hamstrings, 5 to 10 passes, and see what the difference is. And as I mentioned earlier, work on both sides and see how loose things get and how you can move and optimize how you move. So consider the mobility work, consider the stretching. If you're going to do it, right, you can either do some mobility work before you go into your sport, and then what I like to do is warm up, get my body temperature up, do the mobility work, and then I'll do the mobility work and stretching after typically. So I'll do the stretching after, so something to consider, okay? And especially if you're going for strength performance and whatnot, I would put the stretching at the end. So warm up, lubricate the joints, and then essentially do some mobility work, and then do some mobility work plus stretching at the end of, what is it, volleyball, sport, basketball, strength training, whatever it may be. So consider all that, and then you bring it full circle. You know, we see many patients in the office that may have low back, knee challenges, or they're just looking to help their bodies work at their best. And that's really much of our message in terms of optimizing function and structure. And a lot of times you may have a knee challenge, but you look upstream, your hip's not working properly, your pelvis isn't moving properly, and neither are your lumbar spine, your joints in your lumbar spine and your upper neck. And one thing I do like to share is oftentimes, and this is the neat part, oftentimes when you're uncomfortable, your stress levels change. So if you're uncomfortable, you're not sure what's going on, your stress levels may be higher. And if your stress levels are higher, your muscles may be more tense, protected, you're not going to move as well. So it's going to change the way you move, and if you don't move as well, you may break down more and keep recreating that injury cycle. So consider all that, and the reason I bring it up is because a lot of times chiropractic may have an impact on your stress response. And that's why if you're in a family corrective chiropractic office, in our office, we'd be checking here as well as up here and seeing how to optimize function, and it may have an impact on your stress response, and if you manage that better. If you're less stressed, typically your muscles are more relaxed and you're more ready to, or you're better ready to perform, whether it's exercise or just looking after your kids, your grandkids, whoever it may be. Anyways, I'll talk to you soon, and as you know, I've mentioned in the past, I can't do it alone. I can't do it without you. I got a big mission in terms of helping people understand their health, understand that you need more function to be healthier, and as well share that your spine and nervous system health is vitally important for your overall performance and your health and healing. So I can't do it alone. So if you like this and enjoyed it, please take a moment. My only ask is that take a moment to click share so someone else can benefit from it and enjoy it too. If you know someone directly you're thinking about, grab the link, copy it, and send it off. I greatly appreciate it. I greatly appreciate you. Anyways, I'll talk to you soon. Bye for now.